Come on in, you guys. We got a brand new episode of Jimmy Rants in store for you here today. JimmyRants.com is the website, and all the fun begins over on Instagram. So you got to go follow me there. I am at Livin' Low Carb Man, LIVINLOWCARBMAN. Once you are there, you can engage live on the Jimmy Rants show. We go live at 11 a.m. Eastern Time, Monday through Friday on Instagram. We also simulcast over on my Facebook pages, so thank you guys for being here today as well. If you missed the live, it is up for 24 hours over on Instagram, but then they do take it away after 24 hours. So we put all of the archives of the past episodes up on JimmyRants.com if you want to see them there. We also have them on YouTube. And so go to YouTube. You can type in a keyword Jimmy Rants. You will find the show. So we try to provide some really positive, uplifting, encouraging, and yet still informative and maybe a little bit entertaining. When I go off on rants sometimes, you never know what comes out of my mouth. So that's what we do here on Jimmy Rants. And I love doing this show. I literally don't prepare any notes. I just talk from my heart. I've been in this space long enough to know kind of gut reactions to things. And I let my gut reactions come out my mouth. And so thank you for being here, letting me spew out my mouth what you want to hear here today. But today I've got an interesting one, because we have an interesting dilemma here in America right now regarding the COVID-19 coronavirus. Everybody wants to get back to work. Everybody wants to get out of lockdown. Everybody's looking to make things, quote, normal, end quote, again. And the problem with that is we don't have enough testing, or at least they haven't tried to make sure we get enough testing. And so some of the arguments that are put out there is, well, we need more testing to be done. And so the story I have for you here today out of statnews.com talks about another way we could be testing for the coronavirus right now, the COVID-19, that nobody's using currently. And so I wanted to bring this to you sooner than later. I thought it was really interesting. And it's something that I've actually had done not for COVID-19 purposes, but for the purposes of something else, which I'll tell you about here in a minute. So you ready for this? COVID-19 testing issues could sink plans to reopen the country, but could CT scans help? To safely relax the chokehold that policies to control COVID-19 have on the economy right now, most experts agree that the U.S. will need a four-pronged strategy. First, aggressive diagnostic testing for the disease. Second, isolation of anyone who has a case of COVID-19. Third, tracing of all their contacts. In other words, who have they touched and been in contact with, who could have been infected. And then finally, quarantining anyone who might have been exposed until they get clearly uninfected by this. Many public health officials have focused on the challenge of contact tracing, saying it will require an army of workers. In fact, the reopening effort is in danger of failing spectacularly because the U.S. has not even gotten the first and last steps right, which both rely on getting accurate diagnostic testing. In other words, we need to be testing people who are asymptomatic. Let's see what's going on. And then on the tail end, once they've recovered, test again to make sure it's actually gone. The current swab test, which is the popular one for testing for COVID-19, they're missing up to 30% of the infected people. So if this swab isn't actually getting all the accurate numbers of what's happening here, that's a problem. And so are there other alternatives available? In a scramble to fix that before it's too late, a growing number of doctors are calling for the use of another method to detect COVID-19, one that would miss far fewer cases than molecular testing of swabs does. So it's called a chest CT scan. So if you're in the health space and you've been listening to people like me over the years, you kind of know what a chest CT scan does. I have talked about it within the context of detecting for heart disease. You've heard about how health heart calcium score. Try saying that real fast. And that's a CT scan of your chest. I've had 2 of these done in the last decade. And basically what you do is you just lie still and you go through this CT scanner, and it does basically a CAT scan of your chest cavity, and it's looking for calcified plaque for that purpose of that test. But they're saying that it could be used now to detect COVID-19. We're going to find out why here in a second. So, CT scans are far more expensive than the swab. They can expose patients to a low dose of radiation. I mean, unless you're doing these like, every few months or whatever, you're not getting a major amount of radiation, but you do get a little bit. And let's be clear, there are two different kinds of CT scans. I don't know if they made the distinction in here. There's one like the one for the CT heart scan that has extremely minimal radiation dosage, and it takes about 2 to 3 minutes to go through the entire scan, and it's so minimal. There is a second CT scan where they shoot dye through your veins. That's called contrast, where that is extremely high in radiation. So make sure if you're taking this information here today, you're getting the right one. You want the one that's going to cost somewhere between $100 to maybe $250, $300. That's how much this one is. The with contrast dye one is going to be $1,500 to $2,000. And both of these are out of pocket. Insurance does not pay for it. Although if this catches on, I wonder if insurance riders could be thrown in there somehow that would provide these tests for free or at least extremely low cost. So CAT scans more expensive, more exposure to low-dose radiation, and the Centers for Disease Control and Prevention and some medical groups are recommending against using them for using a diagnosis for COVID-19, but they are widely used, or were, in China to help identify the cases happening there, and their reliability there is now fueling growing interest in adding chest CT to the diagnostic arsenal in the US. So China's using it to detect the cases there. And it seems to me you got a lot of people kind of avoiding medical stuff right now anyway. These CT scanners at these hospitals, which just about every hospital has a CT machine. So why aren't we having like people get on a list to come through? How many patients could they get through if they're doing a 2 to 3 minute CT scan? You bring them in there, you get them on the table, you do the CT scan, you get them out. Let's just say that takes 10 minutes. It won't, but let's just say 10 minutes. So in an hour, you could get 6 patients in an hour. And then 6 times 8 hours would be 48 people. And of course, that's just one machine. A lot of these machines are everywhere. We could really test a lot of people really fast as an alternative to the swab if it's not available. The scans detect hazy. This is what they're looking for when they're doing the scan. The scans detect hazy, patchy, ground glass white spots all across your lungs. And that is a telltale sign that you have COVID-19. In one recent study of looking at 1,014 patients, it was published in the journal Radiology, scientists in China reported chest CT scans found 97% accuracy rate of detecting COVID-19 infection. That's pretty good. In comparison, the study found that 48% of patients who had negative results on their swab test were able to get the coronavirus genome detected, showing that they actually did have the disease. The swab told them no, the CT scan with a 97% accuracy rate did. Once you're a couple of days into infection, chest CT scans don't miss it. So in other words, if you just got it, it may not show up on the CT scan, but after a couple of days, it's there. It will show up very clearly on these CT scans. This is an emergency medicine physician in Louisiana, wanted to remain anonymous. With the swab tests missing 30 to 50% of cases, physicians in China called for the diagnostic use of CT early in the outbreak there, and the fever clinics that were set up in Wuhan and elsewhere began using them routinely for treating and detecting COVID-19 in the people there. A positive result on the swab test is usually reliable. If you get a positive test result looking for the RNA of the virus with the current methods we have, it's very likely it's actually a positive, according to Jana Broadhurst. That's an infectious disease doctor and director of the Nebraska Biocontainment Unit Clinical Lab at the University of Nebraska Medical Center. But if you get a negative test result, the chance of it being wrong is about 1/3. That's big. Of every 100 symptomatic people who test negative for COVID-19, 30 of those people actually do have COVID-19. Now, can you imagine you get a swab done and you're told, no, you don't have COVID-19, and you go back out there, and yeah, you're still doing the things to put a mask on and socially distance, blah, 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 but then you still have it. And then tiny droplets come out of your mouth, and someone else picks that up and they get it. Even though you were, quote, negative, they now become positive. You see how this is kind of creating a nightmare. The test totally missed those people. So the main reason for this disparity in the numbers is sample collection. The swab that is supposed to be pushed into the back of the nose. So you're supposed to stick this swab way in the back of your nose, almost painfully, it says, then curve down into the throat. Sometimes doesn't go far enough. So we're supposed to stick a swab down our nose, let it curve down until it reaches the bottom of your throat, and then pull it back up. Who's doing that? Like, if you're doing it self-testing, I mean, you would have to have a medical professional to actually know what they're doing and know what they're trying to swab to get accurate. So are people just not going deep enough because of the pain? That's an interesting little wrinkle in this. The swab can trigger violent coughing, making the technician or nurse taking the sample pull back too soon. We have a mantra in the lab, garbage in, garbage out. So in other words, even if you are having a medical professional help you, if you get a gag reflex or you start coughing or you have other things while they're trying to get an accurate swab, it could be an inaccurate result if you're testing for COVID-19. Because the fault is human error rather than molecular error, there's no technological fix to this. If tests are the first leg of an exit strategy for us to all get back to work, that is what the Johns Hopkins Center for Health Security said in a plan last weekend for reopening the economy, then incorrectly clearing 30% of those who were tested as negative and yet they're still positive would actually doom everything. They could be cleared to return to work when they're actually infectious, and even worse, those who encounter and potentially exposed to the virus would not be identified and quarantined. So here you have 30% of these people getting a false negative, and they go about their life, and they go home and they kiss their kids and be with their wife and whatever, all the things, and then they, unbeknownst to them, even though they got the security in their brain that they, quote, don't have it, they actually do have it. You see how this isn't helping matters. We cannot fully rely on the test to guide decisions crucial to reopening the economy, according to Sandro Galea, a physician and epidemiologist who is the dean at the Boston University School of Public Health. The alarming rate of false negatives from molecular testing, as well as the often days-long wait to get your results, is driving more and more medical centers to adopt CT scans for COVID-19 testing. So if you just joined us, that is what we're talking about here today, with the inaccuracies of the swab test and the long lines and the expenses involved with that. Doctors are now recommending, why don't we get CT scans of the chest, which I talked about earlier, why that detects COVID-19, especially after you've had it for a couple of days. So more and more medical centers are asking for us to please adopt the CT scan. This includes the Mount Sinai Center in New York City and a growing number of physicians all across the country. Last week, the Fleischner Society, which is an international group of chest radiologists, they broke with the Centers for Disease Control and the American College of Radiology, which recommend against the chest CT to diagnose COVID-19. The Fleischner Society concluded it can in fact be inappropriate in some situations, including during a pandemic. So when we need more testing, why aren't we having all hands on deck? And it seems to me if this CT scan of your chest, which would detect an infection happening in your lungs, that would be a telltale sign of COVID-19. Why aren't we doing that now? Does that not make sense? Every ER physician I know recognized the power of these CT scans, says Joseph Freeman, an emergency medicine physician at hospitals in New Orleans. He does 2 or 3 of these CTs on suspected COVID patients every single shift. So if they're coming into his ER, he's putting them through this CT scan already, and he's finding out, yep, you've got COVID-19, or nope, this 97% accuracy test says you don't. Aggressive disease identification would involve both the swab test and a CT test just to ensure the highest sensitivity, missing the fewest cases possible. So I like that idea. Let's swab and do a CT scan, especially if you swab and you get a negative, then do the CT scan as a backup. If you swab and get a positive, then you pretty much know they have COVID-19. Seems like a pretty well done idea to me. Despite China's experience, the use of chest CT scans to diagnose COVID-19 in the US remains very limited. No one has data on how many of these have been done. We know about this New Orleans doctor, emergency room doctor, who does it on his patients there. How many other doctors are doing this on the down low because they don't want to get in trouble for doing a test that the CDC does not recommend? And that's due in large part because they are not recommended. One of their objections is that the CT scanners will get contaminated with COVID-19. Now, I suppose that's a very real thing. If someone has COVID-19 and they're sitting there laying down on that CT scanner, wouldn't that get on the scanner itself somehow? Maybe someone who goes next to get tested would then pick it up and then touch their mouth or their nose or their eyes, and then they have it. So they do address that here. China, whose fever clinics routinely scanned 200 patients a day per machine. Oh, wow. Let's do the math there. 200 a day per machine. So one machine, let's just imagine they went 12 hours. They might be running them 24 hours. Even if you did 24 hours. Man, that's hard to get that many people. Like, let's say 20 hours in a day, that's still 6 to 8. Wow. I mean, they're just like constantly just shipping it in, shipping it out, shipping it in, shipping it out. They even managed to have time in there to clean the machines between the patients well enough to avoid infecting healthcare workers and then the following patients. Researchers there reported last month CT scanning is far safer for the healthcare workers than the swabs that reach the throat via the nose. Yeah, I suppose if you're a nurse and you're sticking a swab down someone's nose down to their throat, the propensity for you to get droplets onto you and then you wipe your nose or your eyes or your mouth is very high compared to putting them through a CT scan where there's very little patient interaction and touch. Often trigger explosive coughing. So yeah, that's the other thing. What if they're sticking the swab down the nose into the throat and then they're coughing from the gag reflex? What happens to the healthcare worker there? Now, yeah, they're wearing suits and things and trying to protect themselves, but dang, that seems like a whole lot more risk than it needs to be compared to doing a CT scan. Thanks to staff training and between patient scanner cleaning, after 3,340 CT scans for suspected COVID-19, another group of physicians in China reported none of their staff in the radiology department got infected with COVID-19. That's a pretty good track record. It's not like China has a monopoly on the CT technology to clean the scanners, said the Louisiana emergency medicine physician I talked about earlier, so as not to anger his colleagues. He wanted to remain anonymous. Are you really going to say your cleaning protocol is why you're willing to kill 1 million people? I don't think it's going to kill 1 million people, but I get what he's saying. If the test, isolate, trace strategy fails because of faulty swab tests, and he makes a good point. Are we going to have this perfectly good scanning device for looking for and detecting COVID-19 and just let it go by the wayside? They're sitting there not being used for the most part in a lot of hospitals. They got CT scanners just sitting there. Could it be used to detect COVID-19, take some of the pressure off of the testing with the swab, or be used as a conjunction with the swab if it's a failed swab test, then put them on the CT scanner just to make sure? I don't see any downside in this. Freeman said he's able to do chest CTs for his suspected COVID-19 cases by getting the technicians and cleaning crews all on board. I tell them, you are the guys who are going to save people from COVID-19. And they are. Another objection to using CT scans is that they cannot easily distinguish between COVID-19, SARS, MERS, and other viral pneumonias, including influenza. So Sanjat Kanjilal is an infectious disease doctor at Brigham and Women's Hospital in Boston. He says they're just not specific enough. Like, yeah, you see that infection in the lungs, but you don't know what it's from. Although right now, are we worried about SARS? Are we worried about MERS? Maybe we're worried about the common flu, but to me, if it's something that could detect something's going on, at least you know this person's sick and they need to be quarantined. That's valuable information regardless of whether it's COVID-19 or not. Although SARS, which is caused by a coronavirus related to COVID-19, was eliminated, MERS, also from a coronavirus, is extremely rare outside of the Middle East. Viral pneumonia looks a lot like COVID-19 on a chest CT. That makes me skeptical that it can have a big role to play, says Ken Gilal. The rate of false positives from misidentifying other viral pneumonias, such as COVID-19, might be as high as 30%, according to radiologist Paris Lagani of Thomas Jefferson University Hospital in Philly. But it would be much lower outside of flu season, which is now coming to an end. See, if we were in the midst of November, December, January, when the flu is the hardest, would we be able to distinguish between the common flu and COVID-19? Maybe not. Now we're in April, heading into May. The flu season is over, yet COVID-19 is still out there. It seems to me that if there is some kind of an infection detected on these CT scans now with testing, that you can almost guarantee it probably is COVID-19. It would be much lower outside the flu season. Regarding scans during a time of flu, and therefore pneumonia is rare, he said it would give us more confidence in interpreting a scan. Also, increasing confidence are artificial intelligence add-ons being developed to reduce how often the scans mistake pneumonia for COVID-19. Those have yet to prove themselves, but radiologists are becoming better at interpreting the chest CTs in potential COVID-19 patients since we're seeing more and more of them. So this is a good point. They're recognizing what COVID-19 infection looks like on the scan. Now, I'm not a scan expert, don't know anything about CT scans and how to interpret them. I'm not a radiologist, but it seems to me they're probably seeing patterns of what it looks like in a patient, especially since this COVID-19 is a heavily fast-moving cascade of inflammation. It would show up in very clear ways on those scans. Even a false positive rate of 30% is less problematic than a false negative, who before COVID-19 gave grand rounds. This Freeman guy talks to hospital physicians warning about the overuse of CT. That's because the consequences of telling someone that they have COVID-19 when they actually have the flu are not like telling someone that she has cancer when she does not. The advice is simply self-isolate in the case of a false COVID-19 positive, a good idea even if you have the flu, and not undergo some kind of dangerous surgery or other treatments. So if you get a false positive and it's not really COVID-19, that's better than getting a false negative and thinking you're okay. Doctors need to think about the false positives differently in the context of COVID-19 pandemic. According to Freeman, he's the former medical director, by the way, for Louisiana's Disaster Preparedness Committee. Reducing false negatives can prevent additional cases and deaths. The false positives seem like a small price to pay for that. I would much rather be told you got it and then get quarantined and try to heal when all I have is the common flu than to tell me I don't got it and then I think I'm okay. And of course, I'm still doing all the right things to self-isolate, wash my hands, put on a mask, and socially distance, all the things they're telling us to do. But I would feel a little more confident thinking, okay, good, I don't have it, but then I do have it. And so there's this chance it could be spread to other people, unbeknownst to me. Absent more accurate COVID-19 tests, states' tentative reopening plans for the economy will be inefficient at best, according to this article, and failures at worst. The many COVID-19 cases that swab tests miss, says Boston University's Galea, is why the proposed Massachusetts contact tracing plan I have seen will quarantine people for 14 days, even when they test negative. A fortnight that someone could have been safely back at work and in the community if only a negative test on the molecular test was more credible. Like many others, however, Galea questions whether something as resource intensive as a CT scan can ever be an effective population-wide screener. He calls it implausible but not impossible. I would love to know how many CT scanners there are in America. Like if we all started signing up now to go get tested. That one lab in China got through 200 people per scanner per day. We've got 330 million people in America. that would seem like it would be a long, long time. We can't possibly have 100,000 of these things in America. I don't know. How many do we have? Some medical person look that up and figure out like how long it would take. You know, obviously the inconvenience for people that are older and who don't want to get out. I think it would be really valuable if you're able to get out and you're able to get tested to be able to get this done. Then you can kind of be ruled out and be part of the pool of no, you don't, and make a statistic of the number of people who don't have COVID-19 as opposed to this running list of who does and who's dying. Those are the stats we're always seeing. Like many others, they question whether something as intensive as CT scans can be effective. The reason for cautious optimism about this is that 80 million CTs were performed in the US last year. So they did 80 million last year. And I'm assuming that's somewhat at full capacity, but of course that was like within regular hours. I wonder if they did these 24 hours a day and just had shifts of radiologists that came in and out and could get these 24 hours a day. Could we get to 200, 250 million people? That would be interesting to see. The country has a lot of scanners, according to this, especially in outpatient settings, and they're also in urban and rural areas alike. So if you live in small town America, and I grew up in a small town in Bolivar, Tennessee, even they had CT scanners in their hospitals. It's not clear how many COVID-19 cases testing can safely miss without sinking reopening strategies that hinge on testing and contact tracing. But Hopkins, Crystal Watson, a co-author of the Reopening Roadmap, says, I think we need to find the vast majority of cases based on the experience of South Korea, upward of 90%. False negatives are going to be a problem and could definitely undermine reopening hope. So you're going to be hearing a lot of things in the coming days about reopening the economy. I know a lot of governors are getting kind of antsy about wanting to reopen because they see the destruction that's happening. I shared a story last night about how 1 million jobs every single day we stay quarantined and holed up in our house and on this lockdown, 1 million new jobs are lost. I think I saw the total as of this morning, 23 million people are currently unemployed because of COVID-19, and it's only going to get worse and worse and worse. So we've got a dichotomy of things here. The economy is not doing well, so we need to get people back to work that are not working, but then at the same time we got to make sure we're not in this same boat all over again within a few months from now to have to be quarantined all over again, and nobody's going to want to do that. Once they free us to get out of our houses, then Pandora's box is open and people are not going to have the fortitude to want to get back quarantined again. So what do you think about this CT scan? Have you ever had a CT scan of your chest? It's very painless. It's really no big deal. And like I said, I've had 2 of them, which, by the way, I did them for the purposes of looking for heart disease development because I eat a high-fat diet. People say if you eat high-fat, you're going to clog your arteries. And so you actually look for calcified plaque, which would be the reason why you would have heart disease develop. And both times that I've got a CT heart scan, it came back 0. Well, that's not what this one would look for. It would be looking in your lungs to see if there's any infection there for COVID-19. Do you like this idea? Are you surprised to hear the swab has about a 1/3 false negative? I was shocked when I read that. Yeah, it's scary out there. So if this is an option, why aren't we using it? All right, let's see what you guys have to say. I'm going to go to Instagram Live first, then I'll come over to Facebook Live. Just a reminder here on Living La Vida Low Carb Facebook page, thank you for being here as well. Can't see your comments, but I do look at them after the show. But welcome in, you guys. Come on in. JimmyRants.com is the website if you're interested in checking out the past episodes that we've done on here. Gela says, unfortunately, the scan is shut down for almost an hour because the area has to be cleaned. Yeah, Gela, in China, somehow they found a way to clean it pretty quick. So I guess we need to figure out what those modalities are for cleaning it. Yeah, because they're pumping out 200 people on one machine an hour. I don't know how they're doing that. Or a day, excuse me, not an hour. 200 an hour would be a miracle. No, 200 a day, sorry. But still, even that is a lot of people in the period of a day. Bonnie says, will insurance companies not want to pay for all those scans? They're always trying to get out of paying for stuff. At least I'm always hearing horror stories about that. Well, we just got this stimulus package where we all got a big old check. Well, not all of us. I didn't get one, but most people got a check to stimulate. I wonder if they could be paid for, or at least a shared cost somehow with the insurance companies with some more thing. This is imminent that we get all of this testing done, or we can't talk about opening the economy till that testing has actually been done. Kat says, why we train our doctors and wouldn't trust them in terms of diagnostic or treatment. Why does everything have to be the effing FDA approved? And it's not just FDA approved. Right now it's CDC approved. Right now it's World Health Organization approved. We're letting so many people dictate how this goes that, yeah, I'm with you, Kat. Let's trust these doctors that have been trained in how to deal with this and how to test for this. And they're first doing no harm, trying to help their patients. I don't know that about some of these other organizations that are making these mandates from on high. Keto Nourish says a medical professional has to do the nasal pharyngeal deep swab. The self swab is just one, I don't know what that word is, only. Yeah. Yeah, and I don't know how many people are getting this test, but they were talking about mail us all a kit to do at home. How many people would get the kit and go, okay, swab, I'm sorry, what? And they just like kind of a little bit in their nose and pull it out. Well, that's not going to tell them anything. It's got to go in the nose, go deep into the throat, and then pull out. How many people are going to do that on their own at home? And does that help us? And then look at the expense that would be. They rule out influenza A and B, strep first before allowing COVID swab. Interesting. That's good to know. Thank you for that information. Fever, dry cough, CT scan with bilateral lower infiltrates equals positive COVID diagnosis. Yeah, a lot of misspelled words in there. So I was trying to like read between the lines of what you were saying. Jess says the problem with all of these tests is they only capture a person's virus state at the moment of testing. They can be infected minutes later, invalidating all the results, like catching sand in a sieve. Yeah, you're right. It is a moment in time. Just like any testing, you guys, everybody's like, oh, well, I got a blood test and it showed my triglycerides were 147. Oh my God, I thought keto was supposed to keep it down. And I'm like, did you eat like right before that test? Yeah, I had something to eat like an hour before. Yo, duh. There's why you had higher triglycerides. So you're right. The situation does matter. Bonnie says, it seems like a very simple test, the CT scan. I prefer that compared to gagging. Yeah, I have a major gag reflex. I do not like stuff down my throat, my nose, nothing. So I agree with you. Lena says, I've had 2 of them, the CT scans in the past. Yes, very painless. Not surprised by the swab problems. I still think antibody tests should be priority, says Kat. I agree. Antibodies, it's not being promoted enough. I agree with you. I think if we got antibodies, which again, this is, you already have COVID-19 and you've beat it, your body has built up antibodies to it. That would be really interesting information. But she says, given its accuracy, sensitivity, and specificity of these tests is another question. Lena says, I think the other problem would be related to them wanting to do the test. Right now, hospitals here in Illinois are not dealing with anything that is not emergency, so government would have to approve. Yeah, there's a lot of kind of moving parts to this, especially in the midst of this. But it's exactly why we're in the midst of this, why we need to do this, especially if all these government officials want to reopen the economy for the obvious reasons. We need to know what we're dealing with. So this is all prescient information. All right, thank you, Instagram. We're going to pop over here to Facebook Live. Real interested to see what you guys have to say. Thanks for being here. All right. Berkeley says they wipe the machines down between patients. Yeah. And I'm sure there are certain protocols for making sure it's a thorough cleansing and disinfecting. It seems like it wouldn't be a difficult task. John says, I honestly think people need to get past the fear and know that many people will be infected and move on. That's the thing, John. I've been talking about this for a little while, and on last night's Jimmy Rants at 5 p.m., I talked about that very thing specifically. How many people got this in, say, November, December, January? got it, was over it, done. And so the whole herd immunity thing came up with what I was talking about last night. What if all of this quarantining could be a little bit overkill? I'm not saying that it is. I'm saying what if it is, if we've already been exposed to this pretty heavily. And look at what it's done to our economy. Look at what it's done to the mental health of people right now. I talked about the suicide rates last night as well. Are we going to have more suicide deaths this year than COVID-19 deaths? A lot of stuff going on here. CT scans for the masses are totally impractical. John, I'm not saying it's practical. I'm saying it could be an adjunct to the swab. And it could be an adjunct to the swab that is showing a false negative when it's actually a positive. So if somebody gets a negative on the swab, is it impractical to have those people then go do a CT scan just to make sure it wasn't a false negative? I don't think so. Tammy says, I had the nasal swab and it was the most painful experience. I would much rather have a CT scan. Well, me too, Tammy. And considering the swab has such a failure rate of a false negative, and the swab has that, and the CT scan has a 97% chance of detecting that you at least have the flu or some other pneumonia or something going on, and very likely COVID-19, it seems to me CT scans would be a good option, at least. I don't know. See if there's any other things over here on Instagram. Jess says they also don't know how long the antibody protection will last. Oh, that's true, because we are talking about and hearing about in China that there's a second wave of people getting sick again, even after they recovered from COVID-19. They're getting it again. So is it a new strain of the same COVID-19? We don't know. I guess that's kind of the thing that's bothering the people trying to figure this out the most is, has this thing mutated and become another version of itself, which is not uncommon. The answers are we don't know. Once IgG, it's pretty stable immunity, and that was proven according to Kat. So guys, CT scans, have you heard about this as an opportunity to detect COVID-19? And they're finding that it's a 97% accuracy rate. It seems to me if we're looking for more ways to get testing done and there's not enough swabs, or we're running out of availability of people being able to get tested that way, or we're worried about false negatives with the swabs, and there's another way to get a 97% accuracy rate, why aren't we using this? So if you hadn't heard about this before, now you know about it, and hopefully this was useful information. Jack said, I definitely had not heard about the CT scan thing. Yeah, this literally just came across the wires today. Again, statnews.com. And it's so simple. I've had 2 of these CT scans and they are painless. It's about 2 to 3 minutes long. Yeah, it's nerve-wracking because you got to hold the breath and hold it in. And then as you're going through there, you hold it, but you don't hold for more than like 10 seconds. And it can definitely be helpful. Gela says there's no perfect test. In California, we're planning on reopening soon. The governor says it will be the new normal, wearing a mask and no public gatherings. Yeah, for me, it's going to be interesting once we reopen. Like, nobody's going to go running up to hug somebody. Nobody's going to grab at a door without like using a tissue or something to grab. Nobody's going to like immediately go back to the way things were. And I don't think that's going to be that way for a little while. And as a college and professional sports fan, there will be no fans in stands for a little while, which I don't go to games, but I definitely like watching them on TV. And I have a feeling we're going to be watching a lot of sports on TV without any fans in the stands. But I think psychologically, for those of us who use sports as an escape, we need that. We need that right now. Bevy Girl says, I need the antibodies test. Any info on that? So this is something that I know several companies are working on. 23andMe, I know, has a kit that they've been working on. And of course, that's the big question right now, is there's a lot of people wanting that test, and its availability of being able to run that test on yourself that is harder. The only thing I can think of is try to reach out to the doctor friends in your life and see about how you could get them. But I am like Kat on here has been talking about we need antibodies tests, antibodies tests, antibodies tests. And I agree with her. If we could make that more widespread and easily available, how hard would it be for them to mail everybody an antibodies test in the mail? It doesn't seem that hard, and it would definitely give a lot of answers. Jax says Canadian healthcare seems to be more minimalist. We don't go to the doctor or take meds for the flu here, which is I hear is a common practice in the US. Oh, don't get me started on people going to the ER in America as their primary care physician for a little sniffle. It's like, I'm one of those people, if I get a little sniffle, I'm not doing anything. Even a couple weeks ago when I got that really tired feeling, I didn't immediately go to the doctor, even though a lot of people told me to. My aunt thought I was having a heart attack. I was like, I'm okay. But it's just funny. People overuse the medical system here in America, and yet where they have universal health coverage like they do in Canada and in Europe, it's very minimalist. You go when you need to go, not just on a whim. All right, guys, let me pop off of here. That's it for this episode of Jimmy Rants. JimmyRants.com is the website. If you want to engage live in the content, go follow me. I'm over on Instagram, Livin' Low Carb Man, LIVIN LOWCARBMAN. Once you are there, engage live in the content. We go live Monday through Friday at 11 a.m. Eastern Time. Occasionally I do 5 p.m. I've done 5 p.m. Eastern Times this week, so no more the rest of the week. I'm going to take a break this afternoon and tomorrow, but usually it's 11 a.m. for sure every single day here on Jimmy Rants. Then you can go, if you missed the live, you can watch it on replay for up to 24 hours on Instagram. After that, you have to go to either JimmyRants.com, where we house all the past episodes, or on YouTube, type in a keyword, Jimmy Rants, you will find the show. I will tell you, tomorrow is my Ask Me Anything, and so if you have a question for me, literally about anything you want to ask about, keto, fasting, cholesterol, COVID-19, being a podcaster, writing book, whatever is on your mind, you can even ask me some personal questions. I'm okay with that as well. We'll be doing Ask Me Anything at 11 a.m. Eastern Time on Friday. So be there, be square. And until next time, we'll see you then. All righty.